Zolpidem Tartrate Er is a medication used for a short period to treat insomnia in adults. It helps you fall asleep faster and stay asleep longer, improving the quality of your sleep. It may also reduce the number of times you wake up during the night. Zolpidem belongs to a class of drugs called sedative-hypnotics and works by producing a calming effect on the brain. The recommended daily dosage of Zolpidem Tartrate Er varies depending on individual needs, and it is best to take it right before going to bed. Before starting to take Zolpidem, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth on an empty stomach once a night, right before you get into bed. Swallow the tablets whole, do not crush or chew them. Do not take a dose unless you have time for a full night's sleep of at least 7 to 8 hours. The dosage is based on your gender, age, medical condition, and other medications you may be taking. Do not increase your dose, take it more often, or use it for longer than prescribed. Women and older adults are usually prescribed a lower dose. If you suddenly stop using this medication, you may have withdrawal symptoms, so your doctor may lower your dose slowly. This medication may sometimes cause addiction, so take it exactly as prescribed to lower the risk. If this medication stops working well, talk to your doctor. If your condition lasts after 7 to 10 days, or if it gets worse, tell your doctor. If you have trouble sleeping the first few nights after you stop taking this medication, contact your doctor. If you experience dizziness, let your doctor or pharmacist know. This medication may cause daytime sleepiness, so inform your doctor if you experience this. Your doctor may need to adjust your dose. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the risks. While many people do not experience serious side effects, contact your doctor immediately if you experience memory loss, changes in mood or behavior, or signs of an allergic reaction. It's important to seek medical help right away if you notice symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. There have been rare cases of people getting out of bed and driving vehicles while not fully awake after taking Zolpidem Tartrate Er. Some have also been reported to sleepwalk, prepare/eat food, make phone calls, or engage in sexual activity without fully being awake. These individuals often do not remember these events. If you experience any of these activities after taking this medication, it is important to inform your doctor immediately. It is advised not to take this medication or similar medications if you have had this reaction in the past. Before taking Zolpidem Tartrate Er, it's important to talk to your doctor or pharmacist about any allergies you may have or if you have any other health conditions. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your healthcare provider. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have kidney or liver disease, mental health issues, a history of substance use disorder, sleepwalking, lung or breathing problems, or a certain muscle disease. After taking Zolpidem Tartrate Er, it's important to avoid driving, using machinery, or doing any activities that require clear thinking. This medication may affect your thinking and increase the risk of falls, so it's important to be cautious. It's also important to avoid alcohol and marijuana while taking this medication. In terms of dosage, children may be more sensitive to the side effects of this drug, and older adults may also be more sensitive to side effects, so it's important to be aware of these potential effects. If you are pregnant, it's important to use this medication only when clearly needed, and if you are breastfeeding, it's important to discuss the potential effects on your baby with your doctor. Before having surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to be aware of potential drug interactions with Zolpidem Tartrate Er. Some medications, such as sodium oxybate, can interact with Zolpidem and affect how it works in your body. Other medications, like azole antifungals, rifampin, and St. John's wort, can also impact the effectiveness of Zolpidem. Taking Zolpidem with other products that cause drowsiness or breathing problems, such as opioid pain relievers, muscle relaxants, or antihistamines, can increase the risk of serious side effects. It's important to talk to your doctor or pharmacist about any other medications you are taking to ensure they are safe to use with Zolpidem. Additionally, be cautious of other over-the-counter products, like allergy or cough and cold medicines, as they may contain ingredients that cause drowsiness. Make sure to check the labels and ask your pharmacist about using these products safely. If someone has taken too much Zolpidem Tartrate Er and is experiencing serious symptoms like passing out or difficulty breathing, it's crucial to seek immediate medical help. In the US, you can call 911 or reach out to your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include slowed breathing or falling into a deep sleep from which you cannot be awakened. It's important not to share your prescribed medication with others, as it is against the law. As we age, our sleep patterns may change and we may experience interruptions in our sleep. If you're struggling with sleep, it's important to consult your doctor or pharmacist for non-medication solutions, such as avoiding caffeine and alcohol before bedtime, avoiding daytime naps, and establishing a consistent bedtime routine. If you happen to forget to take a dose of Zolpidem Tartrate Er, it's best not to take it unless you know you'll have the opportunity to sleep for 7 to 8 hours afterwards. It's important to ensure that you have enough time to rest after taking the medication. When taking Zolpidem Tartrate Er, it's important to store it at room temperature and away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.